Hi, this is George from the Fits on the Go blog, and I have the privilege to interview Dr. Michael Landzberg. Today, Dr. Landzberg is from the Boston Adult Congenital Heart group in Harvard in Boston, and we're extremely pleased to see you today. And we're actually very grateful that you had a few minutes to consecrate for us. Uh, Tell us a little bit. You are probably a very loyal and recurrent customer of the ACC, but what are you looking forward to this year with all the sessions and the topics that are available?
Thanks, George. This year in particular, the ACC sessions have probably the greatest breadth with regard to our subspecialty, congenital heart disease, bridging both the general cardiologist together with the pediatric cardiologist and the adult congenital cardiologist. There's much more involvement at the fellowship level, at the FIT level. The poster sessions probably have the greatest participation than we've had in years, and that's really where the highlights are going to be. Today there's a session with regard to FIT training, and there's a great session with regard to adult congenital heart disease for the general cardiologist. So this is where the action is, George.
That sounds fantastic. We are all looking forward, especially us fellows in training, to the advent of the new American board in adult congenital heart disease. And we know that you're one of the pioneers and one of the most proponents of the work that led to this, I think is actually a breakthrough in cardiac subspecialties. Can you tell us a little bit more about that?
This is, in many ways, the legitimization of decades of work that have been done by so many great pioneers. As of about 2015, there'll be the first sitting for examination for this new subspecialty of care for the adult with congenital heart disease. The real beauty of this is that you can enter this field through almost any pathway: general pediatric cardiology, internal medicine cardiology, med-peds cardiology. There are going to be so many folks that now will have their career, their lives based in the innovation, the care, the advocacy for adults with congenital heart disease. We look forward to this. We look forward to folks from all ways of life coming into adult congenital heart disease care.
I also know for a fact that you're about to give a lecture for the fellows in training about careers, and I'm pretty sure it's going to be a very informative part about how enduring and how also rewarding it will be for people to go into the field of adult congenital heart disease. What's your feeling so far? How have you been seeing the vibe among the fellows in training regarding them being open to new pathways of career making, new career path, and new subspecialties in cardiology? Or do you think we're all just being extremely conservative, going through the traditional tracks?
George, there's two answers to that question. There's a biased answer, which is my own, and I have the best job in the world. I could not imagine anyone being happier in terms of what they do, in terms of the science that we do, the clinical care, and the administrative kind of efforts that I lead. In the same breath, I will tell you that people need to love the field that they choose. I could not imagine someone loving something more, but I think that if any fellow is moved by this aspect of congenital cardiology, there is a career in every aspect, from most basic of science to most clinical of efforts, and those careers await you. There are loads of them, and welcome.
Well, what can you say after that? Dr. Landzberg, thank you so much for an inspiring interview, and we're looking forward to your lecture.
My pleasure and honor.